Hey everyone, if you've ever been handed a speech evaluation for your child, you've probably seen some incredibly intimidating terms on there. I mean, words like glottal stops, pharyngeal plosives, or velopharyngeal mislearning, they can sound completely overwhelming to any caregiver. But listen, I'm here to tell you a little secret. Correcting these errors usually doesn't require a medical degree. It actually comes down to simple mechanics, targeted feedback, and just a bit of patience. In this explainer, we're going to translate all that clinical jargon into practical, easy steps you can take right in your living room. Okay, let's dive into this.
Now, the information we're going over today comes directly from the official speech therapy technique guide from the Division of Speech-Language Pathology at Cincinnati Children's Hospital, authored by Dr. Ann Coomer. So we're using proven, highly effective clinical techniques that are specifically designed to correct placement errors. We're just adapting them so they're totally safe and easy to do at home.
Here is our roadmap for today. We'll cover 1. The power of feedback. 2. Conquering the glottal stop. 3. Fixing nasalized sounds. 4. Addressing pharyngeal plosives. 5. Correcting the lateral lisp. And 6. Home practice for success.
All right, let's jump right into section 1, the power of feedback. Before we even try to fix a specific sound like an S or an R, we really need to talk about the absolute most powerful tool in speech therapy, auditory feedback. And surprisingly, you probably already have it sitting right in your kitchen drawer. The clinical guidelines emphasize that motor learning is entirely dependent on feedback. Think about it for a second. A child literally can't fix a sound if they don't know they're making it incorrectly. They have to build an awareness of what their abnormal production sounds like compared to the actual target sound. You've got to help them hear that difference.
So how do we amplify that feedback? We'll grab a simple, bendy straw. Honestly, this is absolute genius. To check for nasal emission, which is basically air leaking out of the nose when it really shouldn't be, have your child put one end of the straw just at their nostril and the other end near their ear. If they make an oral sound and air leaks out of their nose, it's going to be heard incredibly loudly right through that tube. Conversely, to check for oral airflow, place the straw right at their front central teeth. When they make a T or an S sound, they should hear the air flowing right out the front of their mouth and straight into the straw.
Moving on to section 2, conquering the glottal stop.
A glottal stop often happens when a child tries to compensate for not getting enough air pressure in their mouth. They end up producing this sudden grunt sound by snapping their vocal cords together and releasing them super quickly. To bring physical awareness to this invisible air, have your child stand in front of a mirror and gently place their hand on their neck. Ask them to make that glottal stop sound on a letter like B. They will physically feel a sharp jerk in their neck. Then have them make an M sound, or honestly just a vowel. They'll feel a smooth, continuous vibration. That contrast, that's their baseline.
Now, to actually eliminate that glottal jerk, we use this awesome step-by-step procedure. First, have your kid make a simple P sound with no vowel attached, just a breathy P. Then add an H sound right after it, so it sounds like P, P. Next, blend that into a vowel, like P-ha. Why in the world do we do this? Well, inserting that H physically forces the vocal folds to stay open during the transition. It actually makes the glottal grunt impossible. Once they master this slow transition, you simply ask them to speed it up until the word sounds totally normal.
Okay, section 3, fixing nasalized sounds.
Sometimes a child's speech sounds overly nasal simply because the back of their tongue is sitting way too high in their mouth. It pushes the sound up into their nasal cavity instead of out their mouth. The fix for this is surprisingly intuitive. Ask your child to produce a massive, totally exaggerated yawn. When you yawn, you naturally push the back of your tongue all the way down, and you lift your soft palate up. Have them really focus on that stretching feeling in the back of their mouth. Then, have them try to produce their troublesome sound while holding that deep yawn position.
This is especially a game changer for sounds like at the end of a word. The source material describes a very specific, cool tongue placement for this. Have the child shape their tongue into a boat. The back sides of their tongue need to touch the gums right behind their back molars. Ask them to make a wide smile and then literally tell them to back up the boat so the tongue touches the upper gums on the sides. The middle of the tongue stays nice and low, just like the bottom of a boat, which allows the sound to resonate perfectly.
But look, as any parent knows, kids don't always get it on the first, second, or even 10th try. What happens if you're trying this out and your child just continues to raise the entire back of their tongue, creating a very nasal sound instead?
So, here is a crucial, incredibly effective troubleshooting maneuver. If they keep falling back into that nasal ing sound, simply have them reach up and physically pinch their nose closed while they try to make the sound. An ing actually requires air to flow through the nose, so if the nose is pinched closed,
that incorrect sound literally becomes impossible to produce. It physically forces the air and their tongue to figure out a completely new oral pathway.
All right, Section 4, addressing pharyngeal plosives.
So a pharyngeal plosive is when a child substitutes a deep back-of-the-throat sound for consonants like K or G. Imagine your kid trying to say the word go, but it sounds more like a harsh scrape in their throat. To correct this, we actually use the very sound we were just trying to avoid, the eng sound. You see, the eng sound actually puts the back of the tongue in the exact right position for a G or K. So have them make an eng sound and freeze their tongue right there. Have them take a breath, hold that tongue placement, and then suddenly drop their tongue. The result is a perfect G sound. Once they can do that, simply ask them to whisper that exact same movement, and magically you get a perfect K sound. It's honestly a brilliant little mechanical workaround.
Next up, Section 5, correcting the lateral lisp.
With a lateral lisp, the tongue accidentally touches the roof of the mouth or the front teeth, which blocks the front exit and forces air to spill out the sides. Think of a child trying to say sun, but it sounds sort of slushy and wet. To fix this, we're going to bring back our trusty straw. First, have your child put the straw right at their front closed teeth while making their lisped S. They will notice absolutely nothing. No air is going into the straw. Next, use that straw kind of like a stethoscope and move it along the side of their teeth until you hear a loud rush of air. Boom! You've just hunted down exactly where the air is leaking laterally.
Now, to fix it, put the straw back at the front center of their mouth. Have them make a hard, sharp T sound, pushing the air forcefully into the straw. Once they feel that forward airflow, have them close their teeth, make the T, and just drag it out, like t, s. This clever progression from a strong T physically forces the air straight over the tip of the tongue, right where it belongs, effectively turning it into a proper S.
Finally, Section 6, home practice for success.
You know, having the techniques is really only half the battle. The other half is how you implement them to build a winning daily routine at home without burning out you or your child. And here is perhaps the most absolutely crucial clinical warning in this entire explainer. Do not use blowing exercises or sucking exercises. The clinical guidelines are totally explicit about this. Speech errors are almost never caused by muscle weakness. Trying to strengthen the mouth with blowing games simply does not work. Instead, you want to focus entirely on articulation practice, teaching the mouth the correct physical placements we've been discussing today.
Motor memory relies strictly on practice. You really want several, very short sessions throughout the day. We're talking 5 minutes before school, 5 minutes before dinner. Consistency is absolutely your best friend here. Keep a small notebook to jot down how many correct sounds they produce each session, just to easily monitor their progress. However, the guidelines also note that if you are practicing consistently and zero progress is being made, don't force it. That is the time to stop and consult a specialized craniofacial team just to ensure there isn't an underlying physical structure issue. So, are you ready to turn a plain old household straw into your child's most powerful communication tool? Remember, changing a child's speech isn't about expensive equipment or fancy gadgets. As we've seen from these clinical guidelines, it's all about giving them clear physical placement cues, providing immediate feedback so they can actually hear the difference, and approaching daily practice with patience and connection. You absolutely have the tools to do this. Which makes you wonder, if simple mechanical tweaks and immediate feedback can completely rewire a child's speech, what other impossible learning hurdles in your child's life are just waiting for the right feedback loop?